Oftentimes people will see an orthopedic surgeon and automatically think that everything is treated with surgery, but in fact it's quite the opposite. I would say 95% of the pathology or ailments I see are treated non-operatively, meaning that we can treat injuries with physical therapy, anti-inflammatories. Sometimes if people have the itises or inflammation in their rotator cuff, inflammation of tendons, we can treat it with cortisone injections, and those are very safe. There's even newer cortisone injections which are longer acting, cortisone injections that have slow release that can help decrease inflammation over time. There's also novel techniques with biologics, and this has been the exciting thing with orthopedics and musculoskeletal medicine in general, is that we can use cells in your own body to help heal things or heal things faster. One of them is platelet-rich plasma, which essentially we take a patient's own blood, filter it with a centrifuge similarly to what was used in high school, and of course it's more complex than that, and we have special filtration systems, but we isolate the healing factors. It's called platelet-rich plasma. Platelets, and there's intrinsic factors in your blood that are what naturally heals. Healing at its most simplest is, say you have a cut or an injury, you have bleeding into the area. Well, in that blood are healing factors, and they come in and heal you. So what we're doing is basically isolating these healing factors, putting them in areas that are failing to heal or slow to heal, and we help you heal. A hot topic in the media is stem cells or bone marrow aspirate or mesenchymal progenitor cells. These are all fancy words for obtaining cells in your body that are early in the cell differentiation line. What does that mean? Essentially, as we develop as humans, we all start from one cell, and they break down into different cell lines, and then with signals to those cells, they become bone, they become tissues in your eye, tissues, and it's very complex, and that's how we become a human being. It's an amazing thing that a certain cell may become a hair, may become. So the idea is to isolate cells early on that have not become something yet, and we take these cells and put it into areas of injury, and hopefully with the signaling in the area, they become what needs to be fixed. That's at the most simplest, and that's what stem cells are. And you can get these early progenitor cells from bone marrow. Oftentimes we can take it from your own bone marrow. And really the newest one is taking these progenitor cells or early lines from your fat. So just like a minor liposuction, we can take cells and then inject it into areas of injury. And that can help regenerate cells in the hopes of both healing injury, but also to prevent degeneration and help things possibly such as arthritis, where we have breakdown of tissue. At Active Orthopedics, we use patients' own cells, own progenitor cells, to help the healing process. We do not use embryonic tissue or donated tissue. A misconception is that we can take stem cells, bone marrow aspirates, just inject it into an area and everything is healed. Obviously, this is a more complex process. It involves physical therapy, it involves behavior modification, rest. You have to allow the body to heal. So non-operative treatments, people think of it more simplistically, but actually it can oftentimes be more complex. And at Active Orthopedics, we're able to direct you and to direct the therapist to get you healed and back to doing the things you want to do.